What are the things that must be included in any new hair transplant patient consultation? Here are the top 5 things I train providers in talking about or showing. And number 1 is explaining preservation versus restoration. Restoration, hair transplants. That's why they came through the door. But I think it's borderline unethical if you don't explain preservation. The hair transplants will likely stay for years and years and years. However, loss will continue, especially if it's androgenic alopecia. They must understand that they have to address both, keeping what they have and doing the surgical procedure of the hair transplant. Number 2, scoping, dermoscoping, whatever you want to call it. I think it's so important to show a patient their miniaturization so they understand the reality of continued loss of the hair they already have. I explain it like being pregnant. I have 2 kids. It's wonderful when you find out you're pregnant, but what happens when you go to that ultrasound? There's a reality to that pregnancy. The same when explaining miniaturization and hair loss. Number 3, explaining the big 4 that the medical community recognizes that can actually help stop hair loss and help cause hair regrowth. FDA cleared, FDA approved, other procedures. They are, of course, minoxidil, finasteride, PRP, and low-level laser therapy, often referred to as photobiomodulation. The patient must understand these 4. Additionally, in this internet age, it is extremely likely that they've already Googled this stuff, and a lot of what they're doing in your office is seeing if they got what I call a smart person. If you don't talk about them and explain them to the point where they can learn more than they already have, they're not going to believe they got a smart person, and they are not going to take your advice on next steps. They'll continue on looking for someone else. Number 4, show clinical trials or meta-analyses that explain these 4 so they know the best one that they should choose. Your recommendations are super important. One meta-analysis that I have that I've used many times clearly shows photobiomodulation or low-level laser therapy is the most effective of the big 4. Of course, there are others that show other things, but it's undeniable that the clinical trials are incredible of what photobiomodulation can do. And again, it's the one that you only buy once. The other ones you buy over and over again. And again, as part of being ethical in the consultation, you need to ask yourself, what will the patient do? What will they continue to do for years and years and years? If they drop out of something, they're going to go right back to their hair loss and be unhappy with the consultation they had years earlier. And number 5, I believe you have to explain the advancements and tell them about the latest technology. Clearly in photobiomodulation or low-level laser therapy, SMT or surface mount technology lasers is the latest and greatest. It's the latest technology. The OXO cap is the first ever FDA cleared laser cap with SMT lasers. Let your patients know not only are they getting the best, but that you care that they're getting the best.